Hello and welcome. Today we're diving into the world of esophageal spasms, a condition that can cause unexpected and sometimes painful disruptions to the way we swallow. We'll explore what causes these spasms, how they affect your body, and what you can do to manage them. Get ready to learn about the ins and outs of this fascinating, albeit uncomfortable, digestive disorder. So, what exactly causes these esophageal spasms? Well, the truth is, in many cases, the precise cause remains a mystery. However, several factors are believed to play a role. These include abnormalities in the nerves that control the muscles of the esophagus, which disrupt the coordinated contractions needed for swallowing. Psychological stress and anxiety can also be triggers for some individuals. Certain foods and drinks, such as very hot or very cold liquids, red wine, and spicy foods, might also contribute to esophageal spasms in susceptible people. In rare cases, underlying conditions like gastroesophageal reflux disease or GERD can exacerbate the problem. To understand esophageal spasms, we need to peek into the inner workings of your esophagus. Normally, when you swallow, the muscles of your esophagus contract in a smooth, coordinated wave, pushing food down towards your stomach. In esophageal spasms, this coordinated pattern goes haywire. The muscles may contract forcefully and chaotically, like a disorganized orchestra. These spasms can occur intermittently or simultaneously along the esophagus, disrupting the normal flow of food and liquid. The abnormal contractions can lead to a buildup of pressure within the esophagus, contributing to the pain and discomfort associated with the condition. In some instances, the lower esophageal sphincter, the valve that separates the esophagus from the stomach, may not relax properly, further complicating the swallowing process. While esophageal spasms are incredibly common, they can affect people of all ages, though they are more frequently diagnosed in middle-aged and older adults. Men and women seem to be equally affected. Accurate prevalence figures are difficult to obtain because many people experience mild or infrequent symptoms and may not seek medical attention. Therefore, the true extent of this condition might be underestimated. Now, let's talk about the telltale signs. The most common symptom of esophageal spasms is chest pain, which can be intense and mimic the pain of a heart attack. This pain can come on suddenly and last for minutes to hours. Another hallmark symptom is dysphagia, or difficulty swallowing. This can manifest as a sensation of food being stuck in the throat or chest. Some individuals also experience regurgitation of food or liquids, heartburn, or a feeling of pressure or tightness in the chest. These symptoms can vary in frequency and severity from person to person, making diagnosis sometimes challenging. Diagnosing esophageal spasms usually involves a combination of tests designed to assess the function and structure of the esophagus. One common test is esophageal manometry, which measures the pressure and pattern of muscle contractions in the esophagus during swallowing. This test can identify the uncoordinated and forceful contractions characteristic of esophageal spasms. A barium swallow X-ray is another useful tool. It involves swallowing a barium containing liquid, which coats the esophagus and allows doctors to visualize its shape and movement on an X-ray. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, can help rule out other conditions like inflammation or structural abnormalities. In some cases, an esophageal pH monitoring test may be performed to assess for acid reflux, which can contribute to esophageal symptoms. Esophageal spasms can be broadly classified into two main types: diffuse esophageal spasm, IF-ES, and nutcracker esophagus, also known as hypertensive peristalsis. In diffuse esophageal spasm, the contractions are uncoordinated and often occur simultaneously along the esophagus. Nutcracker esophagus, on the other hand, is characterized by excessively strong contractions during swallowing, even though the contractions themselves are coordinated. Some doctors also use the term jackhammer esophagus for a type of DS where extremely high pressure contractions are present. Recognizing these different types can help guide treatment strategies. Managing esophageal spasms often involves a multi-faceted approach tailored to the individual's symptoms and the severity of the condition. Lifestyle modifications, such as avoiding trigger foods and drinks, eating smaller meals, and managing stress, can be helpful. Medications, such as smooth muscle relaxants like nitrates and calcium channel blockers, can help reduce the frequency and intensity of spasms. In some cases, antidepressants, particularly tricyclic antidepressants, may be prescribed to help manage pain and reduce the perception of discomfort. If GERD is a contributing factor, medications to reduce stomach acid production, like proton pump inhibitors, may be recommended. In rare cases, surgical interventions, such as myotomy, where the esophageal muscles are cut to relieve pressure, may be considered for severe and refractory cases. Botulinum toxin Botox injections into the esophageal sphincter can also provide temporary relief by relaxing the muscles. Unfortunately, there's no foolproof way to completely prevent esophageal spasms, especially since the underlying causes are not always known. However, adopting certain lifestyle habits can potentially reduce the frequency and severity of symptoms. This includes identifying and avoiding trigger foods and beverages, managing stress through relaxation techniques like yoga or meditation, eating smaller, more frequent meals, and treating any underlying conditions like GRD. Maintaining a healthy weight and avoiding smoking can also contribute to overall esophageal health. The prognosis for esophageal spasms varies depending on the severity of the condition and the individual's response to treatment. Many people can effectively manage their symptoms with lifestyle modifications and medications. While esophageal spasms are rarely life-threatening, they can significantly impact quality of life due to the pain and difficulty swallowing. Ongoing research is focused on better understanding the underlying mechanisms of esophageal spasms and developing more targeted therapies. Studies are exploring the role of specific nerve pathways and inflammatory processes in the development of esophageal spasms. Novel treatments, such as neuromodulation techniques and more selective muscle relaxants, are also being investigated. These advancements hold promise for improving the management and long-term outcomes for individuals with this challenging condition.